access to e-cigarettes. My name is Rob Schwartz, and I'm going to moderate the session today. I am the Executive Director of the Ontario Tobacco Research Unit, and I'm a professor in the Dalla School of Public Health at University of Toronto. And it's my pleasure to be moderating today and not presenting. We do have two presenters from the Ontario Tobacco Research Unit team, and we have two discussants from the wonderful tobacco control community. And I'm going to introduce everybody in due time. Just wanted to say that this topic of youth access to e-cigarettes is hugely important. I mean, how can it be that we have 1 in 5, probably more than that, young people in grades 10 to 12, using e-cigarettes in the past 30 days, if they're not supposed to have them by law? So there's something fishy going on here. Of course, the veterans in tobacco control won't be very much surprised by this. Question is, can we do anything about it? Can we make changes here? And where are they getting these things from? So Sean O'Connor, in his remarks a bit later on, is going to tell you about a test shop that we did on the internet to see if that's a place where a lot of youth may be easily accessing e-cigarettes. So again, thanks for joining today. I just wanted to say that this effort is with support from Health Canada's SUEP project, and it is in partnership with Physicians for Smoke-Free Canada that we are embarked on the project called Addressing Knowledge Gaps Important to Tobacco Control. This webinar today is about a recent series of reports that we did on youth access to e-cigarettes. And we're just going to present some, not everything, but those reports are available to you, and links have been sent out, so you should have access to them. The goal of today's webinar is to assess the evidence for a range of policy options regarding youth access to e-cigarettes, and to discuss their feasibility of implementation in jurisdictions across Canada. So we do encourage you to participate. It's not great in this kind of format. The best way that we find to do it is through the chat. So the chat should be open for you. Please start providing comments and questions. We will address them as best we can during the course of the webinar. And then later on in the session, we'll dedicate time to Q&A. So I'd like to now just move to the introductions of my colleagues, Sean O'Connor and Emily Taylor. Emily Taylor is a research officer at the Ontario Tobacco Research Unit. She's been working with us for several years and is an expert qualitative researcher who did the bulk of the work in the review of literature, both formal and gray literature, for this project. Dr. Sean O'Connor, my colleague who preceded me at the Ontario Tobacco Research Unit. So he's a veteran. Sean is a research associate, and he is a recognized expert in the surveillance of tobacco, e-cigarettes, and cannabis products at their population level outcomes. His current research focuses on tobacco and vaping, and he has an emphasis on how packaging is used to promote industry products. I'm also going to introduce our panelists right now, so I don't have to interrupt the flow later on. Les Hagan is the Executive Director of Action on Smoking and Health, one of Canada's leading tobacco control organizations. He's been in this for at least 3 decades, providing regional and national leadership to reduce tobacco use in Canada, and he has helped to secure numerous important policy measures at various levels of government. Flory Dukas is the co-director and spokesperson for the Quebec Coalition for Tobacco Control, also one of the eminent tobacco control organizations in Canada. Flory completed graduate studies in health prevention at Université de Montréal, and she's worked for over 15 years in tobacco control, including with groups such as Non-Smokers' Rights Association and Physicians for Smoke-Free Canada. She's played key roles in campaigns to ban asbestos mining in Quebec and reduce exposure levels for workers and the public. All of these people have a lot more credits to their name, but I don't want to take all the time talking about them. They can speak for themselves shortly. So with that, I'm very pleased to turn over the floor, the virtual floor, to Emily Taylor. Go ahead, Emily.
Thank you so much, Rob. I'm just going to share my screen. Okay. So as Rob mentioned, I'm going to take the next 10 or 15 minutes and provide an overview of the work we did assessing various measures to reduce youth access to e-cigarettes. I'm just trying to advance my screen. Oh, there we go. So just before getting started, I want to mention the topics that we did and did not cover. It may seem a little bit strange on this list that you don't see measures that are very important when discussing youth access to e-cigarettes, such as flavors and marketing and price. The reason you don't see these topics covered here is because they were covered in previous work on this project. So what we tried to do was to fill in some of the gaps in the remaining topics related to youth access to e-cigarettes. So what we'll be talking about today are interventions to increase the minimum age to 21, to increase compliance and enforcement measures, to address social sources, to introduce retail licensing, and also we'll talk a little bit about outlet density, and also measures related to adult-only stores. Following my presentation, Sean will talk a little bit about measures to reduce online sales to youth. So I'll tell you a little bit about our methods. This work was completed in the spring of 2021, so everything should be up to date as of the spring. We tried to update it a little bit in the last couple of days, but hopefully we're not missing anything. And what we did last year was we reviewed all the literature we could find, both published literature and gray literature related to e-cigarettes, but we also looked at literature related to conventional tobacco, alcohol, and cannabis to see what came forward and what might be relevant to our discussion of e-cigarettes. We also did a jurisdictional scan of policies in place in Canada, the US, and internationally at all levels of government to see what's happening and what some innovations might be. For each of the topics that we discussed on the previous slide, we tried to summarize in the reports what are the potential effects of these measures, what is the technical feasibility, how politically viable would it be to introduce these regulations, and how do they align with the Canadian policy landscape. We also did the online sales test shop, and I'll let Sean talk a little bit about the methods following this presentation. So first I'll talk a little bit about minimum age 21 for e-cigarettes. What we found in the literature specifically related to e-cigarettes was very little. There's not a lot published at this point. There were a few studies that were very interesting looking at if you were to increase the minimum age to 21 for e-cigarettes, what would this do to youth uptake of other substances, very importantly, conventional cigarettes. The evidence is still very mixed, so there's not too much to say at this point other than that it's a very important question in need of further study. We also looked at the evidence related to conventional cigarettes, and there was compelling evidence for age 21 in that literature that may apply to e-cigarettes. The often cited study is an IOM modeling study, which looks at increasing the minimum age to 21 for conventional cigarettes. And it found that it's likely to be very significant in reducing youth use and uptake of conventional cigarettes, and likely to be much stronger than age 19, which we see a lot in Canada. There's also a lot of real world evidence in the US in states and local levels where the minimum age was increased from a lower age up to age 21. We've discussed this quite a bit with our advisory group for this project, and we also saw a lot of commentary in the literature that an age 21 minimum age is not a panacea, and it's really important that it's supported by other measures such as enforcement, price regulations, and regulations related to flavors, and also some concern that age 21 might be used inadvertently to justify inaction in other areas of policy development. In terms of technical feasibility, I'm sure many on the call know that PEI is the first province in Canada to raise the minimum age to 21 for conventional and e-cigarettes, so it should be technically feasible at the provincial level. And the US has recently raised the federal minimum age to 21 for both conventional and e-cigarettes. There's some concern about the feasibility or the unintended impacts of increasing the minimum age to 21 for e-cigarettes without doing the same for other substances, such as alcohol, cannabis, tobacco, and e-cigarettes. But there is a little bit of a precedent for this now at the provincial level in Canada, because PEI has now raised the minimum age to 21 for e-cigarettes. And Quebec raised the minimum age for cannabis to 21 while leaving other substances at a lower minimum age. In terms of political viability, there's strong public support for increasing the minimum age of e-cigarettes to 21. A 2019 Ipsos poll found that close to 80% of Canadians support raising the minimum age to 21. So I know that was quick, but we're going to try to cover a lot of topics today. So moving on to a brief overview of our work on compliant and enforcement measures. First of all, I just want to review what are we talking about when we're talking about increasing enforcement. And the best practices that we're reviewing on this slide here come from the literature on conventional cigarettes, but I think it's important just to review this quickly to talk about what an ideal enforcement system might look like. So an ideal enforcement system should have an agency with clear responsibility for the system, a goal of 95% compliance sustained over time, requiring retailers to pay a minimum fee to fund the compliance checks, test shopping by underage decoys at least once per year, meaningful penalties for non-compliant retailers, no preemption of local ordinances if stronger, as well as education and awareness for retailers and the public. So thinking about effects, what would happen if we had such an enforcement system in place for e-cigarettes? Once again, there's very little published in the literature specifically on e-cigarettes. There was some information in the gray literature. There was a very interesting study interviewing enforcement officers in Ontario, and they raised some interesting challenges related to enforcement, such as the risk of exposing underage test shoppers to secondhand vapor, the lack of familiarity amongst test shoppers and enforcement officers with vaping language, and difficulty knowing where stores are due to lack of licensing measures. There's also evidence from literature on conventional cigarettes, including very strong evidence that any intervention at all that limits the commercial sale of tobacco to minors will reduce youth smoking. We're going to cover social sources a little bit later in the presentation, but I just thought I should mention now that youth who supply to peers generally purchase from retailers. So there's a secondary benefit there. And that if you're able to cut off commercial channels, this reduces the overall supply available to youth, drives up the prices, and discourages sharing among peers. So enforcement tends to dovetail with a lot of the interventions we're going to look at today and reaps secondary benefits, at least in the literature related to conventional cigarettes. In terms of technical feasibility, BC has recently brought in a new system for e-cigarette compliance, which seems to be one of the most rigorous in the country. The literature also raises a number of challenges as well as facilitators to increasing enforcement efforts. Some technical challenges include the expense required to employ enforcement officers, and it can be very complex to implement new systems of test shop protocols. In terms of potential facilitators, retail licensing systems could be very beneficial in improving enforcement efforts by maintaining a database of where retailers are located and allowing enforcement protocols to find them and monitor them more rigorously. It also in the literature, there was some suggestions about some possible innovative enforcement mechanisms, including even potentially, and these are just a few ideas, incentives for retailers, for example, rebating annual licensing fees, or even publishing the names of non-compliant retailers. So it seems that there's a need for more study about a lot of these potential innovations. In terms of political viability, again, polling has shown in general very high support for restrictions targeting youth access to vaping products. But these questions were not specific to enforcement, but I think it's safe to surmise that there would be fairly strong support. We'll now talk very briefly about measures to reduce social sources of e-cigarettes. As many probably know, most underage youth are accessing vaping products from social sources. There's not a lot of literature about potential interventions specifically related to e-cigarettes, but as I mentioned a few slides previous, any measures that cut off access to retail sales are likely to reduce the overall supply available for peer exchange. There is a little bit of evidence from conventional tobacco about campaigns to reduce social sources. Some may remember the Bad Ways to Be Nice campaign in Ontario a few years back, which had some success in targeting social sources of conventional cigarettes. And that's something that could be considered when it comes to e-cigarettes. Retail licensing is another idea that we explored to potentially reduce youth access to e-cigarettes. There's several US state level studies showing that retailing laws may reduce youth access to e-cigarettes. Specifically in Pennsylvania, youth e-cigarette use declined by almost 22% the year after the new licensing law was adopted. As many may know from the conventional cigarette area, that there's some international systems of retail licensing that have been fairly successful. The experts really emphasize the importance of setting clear public health goals. So these systems aren't set up for taxation purposes or other economic goals, but if the systems are set up to increase compliance and reduce density, they can be very successful in reducing youth access. The more that these licensing measures are able to reduce density, the more successful they're likely to be. For example, if you were to use the licensing system to reduce density to 10% of the current level, you would have a big effect in terms of youth access. In terms of technical feasibility, the licensing systems need to have strong compliance efforts attached to them for them to be successful. There are some facilitators that might make this possible. For example, we saw in LA that licensing revenues are used to fund enforcement efforts, and so something like that could increase the feasibility. They're likely to have the greatest effect if they result in a reduction in the number of retailers using e-cigarettes. In Canada, we've seen several provinces that have recently brought in e-cigarette licensing requirements. And there's also some exciting new licensing systems that have been put in place in Toronto and Oakville, which were purposely designed to increase enforcement efforts. And it will be interesting to see what happens over the next number of years. There's also some important examples from US municipalities. As I mentioned, LA has a system where their retail licensing system funds their compliance measures. And also San Francisco and Santa Clara County put licensing systems in place to reduce retail density and restrict selling near schools. Lastly, I'm going to talk very briefly about adult-only stores. There's really no evidence, or very limited evidence, that restricting the sale of certain vaping products to specialized vaping stores will reduce youth access to e-cigarettes. However, there is quite a bit of evidence that youth are continuing to make illicit purchases of e-cigarettes from vape shops. And so it's really important, if this is a strategy moving forward, that enforcement efforts are increased in vape shops to ensure that youth aren't accessing in these locations. In terms of technical feasibility, there's an important precedent from PEI who've now restricted the sale of all e-cigarettes to adult-only vape shops. And also the examples of cannabis and alcohol in many provinces indicate that it's probably feasible to continue moving in this direction. Many provinces, including Ontario, are already restricting the most harmful products and practices to vape shops. So there seems to be a trend in this direction. It's quite possible that further restrictions on all ages retailers could be ramped up over time, increasing measures that target convenience stores and gas stations, and at the same time allowing adults who are accessing e-cigarettes to quit smoking could still access them in adult-only stores. In terms of political viability, as I mentioned before, there's precedents in PEI and also the precedents of alcohol and cannabis in many provinces kind of indicate that it should be possible to move towards more restrictions on all ages stores and allowing exceptions in vape shops intended only for adults. It's very likely that convenience store associations may oppose these regulations, and that's something that would have to be considered. Okay, so that's the brief overview of our jurisdictional scan and our literature review. I hope you'll look at the reports. There's a lot more details there. And for now, I'll pass it over to Sean to talk about the online sales test shop study.
Great, thank you. Just give me a moment here to get my slide.
Thank you, Emily. All right, go ahead, Sean.
All right. So yeah, this is a test shop that we did of online stores in the spring. And I'm here today to discuss this study and present some of the results. So yeah, we started with this basic question: Can an underage youth purchase online e-cigarettes from retailers and get them delivered to them? So that was what we kind of started out with, and then we proceeded to implement this study. So just by way of background, federally, the Tobacco and Vaping Products Act has a couple of clauses that speak to this. And so these are more or less direct quotes from the Act. So we see here, no person shall furnish a tobacco product or vaping product to a young person. And federally, it's 18 or under, or it's 18. It's under 18. The defense is if it is established that the person attempted to verify that the person was at least 18 years of age by asking for and being shown documentation prescribed. And so you had to have picture ID, government ID type of thing. And so that was a defense. Now there's also not only on the selling of the product, but there's also clauses with respect to the delivery of the product. So an online retailer can't send, or a delivery agent can't deliver a tobacco product to a young person. And the defense here is that, verify that the person taking delivery was at least 18 years of age by asking for and examining a piece of identification. And it goes on to say what kind of identification. So, fairly solid, you need to be 18 or over, and you have to have solid ID to get a product delivered to you, and also to purchase a product. Here's a clause that is in the Tobacco and Vaping Products Act. No person shall, for consideration, send or deliver a tobacco product from one province to another unless the sending or delivery is between the manufacturer or retailers or exempted from the application of this section by the regulation. So I just point this out, and I highlighted the word tobacco product. So this literally refers to tobacco, and it excludes vaping products, because in the Act, vaping products is defined separately. So it's my understanding from reading this is that it is permissible to purchase vaping products and get them sent between provinces, but apparently it's not for tobacco products. So that's an interesting, I guess, subtlety of the current legislation. So in Canada, as I mentioned, it's 18 plus federally to legally purchase or to be sold tobacco products and vaping products. This study is about vaping products. It ranges by province and territory from 18, 19, and PEI, as mentioned, was 21. In the US, it's 21 as well. So one thing that we, in the acts of the various provinces and territories, it's not permissible to sell online in Quebec. And we did attempt to purchase online in Quebec, and we weren't able to find a store to sell us to this round. We did this a few years ago, 4 or 5 years ago. We were able to find a few. This round, when we were looking for stores, and I get into this maybe later in a slide, but when we were sampling our stores, we got onto Google and said, top vape shops in. We picked a major city within a territory across the country. So, for instance, top vape shop in Montreal, and we'd frequently jump onto a Yelp link, which lists top 10 vape shops in Montreal. And when we did that, we couldn't find anything in Quebec. Now, some of you folks may know of an online place in Quebec that will sell cigarettes, but it is prohibited, and we weren't able to find any. In PEI, it is permissible, but we weren't able to find any in PEI that would sell us cigarettes online as well. And so, as I mentioned here, it's not permissible in Quebec. In the US, Oregon is also prohibited internet sales of vaping products. Right, so we picked 20 online retail vape shops from major cities across Canada, and we can see here we kind of split it up into kind of Western provinces, loosely defined, Central Canada, excluding Quebec, of course, and then some Atlantic provinces here, and without PEI for the reasons stated previously. So we employed a 16-year-old youth to help us along with this research, and this youth, who was a neighbor of mine, we sat down on a Zoom call. It was COVID was and is still an issue. So he was in his house and I was in my house. We were separated by 2 or 3 houses, but a Zoom session. And we shared screens. We entered a site. He completed an age verification, which I get into in the results. Most sites had an age verification to get into, and he selected a product for purchase, and then went through the payment process and arranged for delivery. That was kind of the goal. And here's the results. So it says here 19 of 20 stores had some sort of age restriction message. So this is when you get into the site. 11 sites requested the visitor enter a birth date. So you get, it's like the cannabis sites in Ontario and a lot of, these vape stores, a screen popped up and say, enter your day, month, and year of birth. And if you enter something that suggests you're underage, it won't let you in. But it's, they don't ask any verification of this. You can just enter in whatever you want, so everybody can get in, type of thing. 6 sites had a visitor checkbox indicating your legal age. So is it like, click if you're 18, click if you're 19, or are you legal age? Yes, no. One site had a message, must be 19 plus. You click that and you're on the site. One site had a pop-up indicating it was a 19 plus site. So you just click that to get rid of it and you're on the site. And one site had a no age check. So we attempted to purchase from these 20 sites. 2 of the 20 sites, when we went in through and tried to make the purchase, literally put it in our cart and then tried to check out, 2 sites requested age identification. And they both used this system here, this token of trust, which was fairly good. So, you had to verify that you were of age, and then you had to scan a picture of your driver's license and send it to them. So this was effective as in stopping us. So the youth, the Confederate there, the 16-year-old, basically stopped the purchase at this point. We couldn't get around this type of thing. So for 2 stores, we stopped the purchases. And for all the other 18 stores, we went on and we made a purchase. The next day, one of the stores that allowed us to purchase phoned us or emailed us, I guess, and said, "Oh, well, we need your ID if we're going to send this to you." So we ended up giving him my ID just to get the purchase. But that was one that, that was an effective old school, approach. Wasn't technological in the sense that, like, not on these screens, but they did stop us by asking for our ID. We were supposed to copy it and mail it to them, or text or email it to them. Of the two retailers that initially stopped us, one of those retailers phoned us the next day and said, "Oh, your sale didn't go through." And after a discussion with the 16-year-old, I said, well, email him back, say, "Sorry, just to back up." He said, your purchase order didn't go through. Here, send us your, information. Here's the link, pay us, type of thing. So I told the youth, well, I said, just go ahead and see if they ask for ID. So he went and said, "Oh, sorry about that. Yeah, here's my information. Here's, where do I go," type of thing. And they just gave him a payment page, and he entered kind of through text and paid them, and got the product that he originally ordered. He didn't have to reorder; it was still on their system. So even though they had this very sophisticated system that you see here, which stopped us, the next day that phone call said, "Hey, your order didn't go through for some reason. Please pay us, and you'll get your order," type. So we did that, and so all in all, of those three, we got, one ended up selling a product, and the other 18 sold us product. So all in all, 2 of 20 retailers did not sell us any product. So that's 10% stopped us, and the other 90% sold us product. So here's just a snapshot, and a little confusing, but the first column is the delivery of the product. We're not going into which retailer, by name, which retailer sold us product, but 18 across the province sold us the product. And here's the delivery agent they used. The delivery location is the second column, and some were sent to the mailbox. Sometimes we got a slip in the mail saying go to the post office. The third column is the package state's age signature. So, must be 19 plus, must be 18 plus, or whatever the age restriction was. And we can see here, this was shipped to Ontario. So Ontario is 19 plus. So they, there was one down there, 18 plus signature on package. Well, in Ontario, it should have been 19, but we probably purchased that from a province that was 18 plus, right? So, so this, and then the last column, age check performed, and that's by the delivery agent. And we see if there was no any kind of message on the package that was an age restricted product, they just gave it to us. And so that is really the fault of the seller, the retailer, not so much the delivery agent, because they didn't know. Even though they did pick it up from a vape shop, they didn't, I guess they didn't have that age restriction signature or note on the package, and they just gave it to us. The other, a number of other Canada Post ones, we had to actually show our ID to pick up the package, with the exception of one. And then some private carriers down below, Purelator signed but no ID check. And then one agent, there was an adult answered the door. It was the parent of this 16-year-old, and they just gave it to the parent, type of thing. They didn't, they didn't check the age of the person that ordered the product. And then one product was never delivered like that. So, I emailed them and tried to phone them a couple of times, but it didn't work out. So I don't know what happened there. Okay. So yeah, so overall, 95% of sites had some sort of self-reported age check when you entered it. So that was just the one site that didn't have any. Only 10% of sites ended up confirming the legal age, and that was our self-reported legal age. 61% of delivered packages had age verification notes on the mailing label. So that is, must be 18, must be 19 type of thing. 61% had them. So among all the deliveries, age was confirmed 55.5% of time. Among packages with that age verification note on it, 91% of delivery agents asked for signature. So there's a fairly big discrepancy there. And as an aside, when we ordered the juice, we ordered flavored products, and we tried to order products that were restricted or prohibited. Candy flavors, baked goods, energy drinks, pop, so forth. And we all the vendors, all the 20 vendors sent us, we were able to order those prohibited flavors from all 20 vendors. And you see here, sometimes we got a couple of bottles at one store for one reason or another. All right, so in conclusion, there is a lot of room for improvement here, given what we found. For the online retailers, age-appropriate ID before final sale, I think, is something that's lacking. Only, 2 stores really, well, 3 stores had age-appropriate ID, but of those 3, only 2 actually followed it to completion. And then notification on the package that it's an age-restricted product is really important, because we see the difference there with something like 55 to 95% in terms of compliance, when with something like 95% when that notification on the package was there. Otherwise, it was 55%, right? So that's really important. Delivery agents. A conclusion here is if you're picking up from a vape shop, you kind of know that it's an age-restricted product, and they should demand an age-restricted message on the pack. So I'm not sure what the legislation is around there. I mean, if they get that package and there's no age restriction on it, I guess they can deliver it. But there could be some room there to tighten up, or for the delivery agents just to have policy in general, even if it's not legislated, just to protect themselves and to protect youth. And then there's room for improvement for asking for age-approved appropriate ID from the delivery agent. For public health professionals, some of the messages that this study suggests is that there's room for education and enforcement. Right? You can take the two-prong approach. You can tell folks whether it's the online retailers, whether it's the delivery agents, you can educate them, or you can enforce the current regulations. Looking at the US specifically, I noted, and this isn't in the report because I just came across this last night, but there is a clause, I guess, in this PACT Act, and just give me, sorry here. And yeah, so it creates a blacklist of non-compliant delivery sellers. And so there, like I said, it says here, it blocks the delivery service from providing their services to the listed non-compliant sellers. So if you're a non-compliant seller, you're blacklisted, and affects the delivery service of those products. And then, according to the Tobacco Reporter, which I believe is an industry kind of tobacco industry magazine, they were just reviewing kind of the current state of affairs, and they mentioned that the U.S. Postal Service has stopped shipping vaping products, and large private companies, including UPS, FedEx, and DHL, they no longer ship vaping products in the U.S. So this is more of just a decision by these organizations, and in part it's related to regulations that they have to go through to actually ship products. Because I think in the US, if you're shipping products, I think the stores have to keep a record of the sale for three or 4 years, if I recall. And there's burdens in place that are making it more difficult for these shipping agents to ship these products. So they've just decided that they didn't need it as part of their business. So in terms of directions for Canada, well, what's happening in the US in terms of blacklisting some sellers that are non-compliant from accessing delivery agents is one avenue, and educating delivery agents themselves and convincing them that maybe this isn't a good business to be in is maybe another avenue that that advocates or even public health programmers could potentially pursue. So with that, I think I'm ready to stop.
Excellent, Sean. Thank you very much, both Sean and Emily. I read both of those reports, and this was a great refresher for me, because I'd forgotten some of the findings, and it's always nice to hear the things spoken. I'm going to just depart for a second from our plan of action here and let Sean answer some of the specific questions in the chat about the test shop that he just presented. So Sean, I've written down some of the questions, maybe just quick answers to these.
Sure.
Okay, so one person is asking if the reason why some packages were just left at the door had to do with the COVID protocol. Do you know?
Yeah, I don't think so, because I get, frequent mail, and
Okay.
a card was left and I had to go to the post office. So, if someone's not home, if they ring the bell, there's no one home, they just leave a card type of thing. So I don't think it was necessarily related to COVID.
Okay. Another person wants to know if you could detect any differences in willingness to sell to minors between small retailers and large retailers, so these big online shops or the smaller ones. Do you know?
Yeah, well, I mean, they all sold. 18 of 20 vape shops sold. So everybody sold basically. Now,
Okay.
I don't really know if they were large or small. The sampling was, the top vape shop in this city, so we picked the 5 or so top vape shops in any given city. So they were, they had a strong kind of customer base that would review on Yelp, or they were online on the web. So I don't know, that could be, my sense is that they were small and big, and some cities like, Moncton, Fredericton, even Victoria, there probably wasn't many more than 5 or odd vape shops in those cities anyway.
Right. And the method of payment, was it always with credit card, Sean?
We used debit card and credit card, and we were trying to get going with BitPay, but and 1 or maybe 2 would have accepted BitPay, but we couldn't get our BitPay to work, and we just were kind of pressed for time, so we just went ahead without it. But that was something to pursue, because I think credit card companies, I think you're not allowed to purchase these products. Actually, I'm not sure if it's that you're not allowed to purchase these products, or they have your age when you use the card, and they should let you purchase them. So that's something we didn't really pursue, but there's something right there to do some research with.
Right. That was from Tim Dewhurst, by the way. Yeah. And Adam Cole is asking if we use different types of ID, or was it always, what ID did the 16-year-old use? And was it always the same one?
They didn't have to use any ID for 18 purchases. They just had to, they just get on the site and say, type in whatever date they wanted to for a birthday. For the 2 sites that requested, 3 sites requested ID, and we backed out of 2 of them, but they wanted, I think, a license. And then the one store that phoned us back the next day, they wanted an official documentation. I'm not sure if it was a license or whatever. And I actually photocopied my license and sent it to them so I could get the purchase, because I really wanted their prohibited flavors from them, like that. But so 18 stores sent them without ID.
Yeah. By the way, you should see Sean's basement full of prohibited substances.
Yeah.
That's joking. Okay, there's a couple more questions, but I think I want to go straight now to our discussants to ask them questions. Les is already primed to respond, but we're going to go to Florrie first, and then to Les. And the first question for both of you, the same question, is, what would be, if you could do one thing, all right, maybe 2, regarding youth access, in order to really seriously decrease the ability of young people to access vape products, what would that be, that one thing or 2 things that you would do? What do you think would give us the biggest bang for our buck, so to speak? Florrie?
Firstly, thank you for inviting me, and I commend you for the research that's being presented. And I do want to point out that the first time I've heard the argument of you know, the legitimizing the ban of vaping in vape shops. Quebec has that measure and it's being heavily contested by the industry. And now I heard that among the points that have been discussed was that it allowing vaping in those shops, you know, potentially exposes youth enforcers and enforcement to secondhand vaping. So I think that's a great point. And I'm thankful that it was brought up, maybe as an afterthought to some of these discussions. I think maybe, you know, I'm not sure that it's the biggest bang for the buck in terms of dealing with the youth vaping per se. But I think that retailing and a robust retailing system is important, whether it's for tobacco or vaping products. And just to allow for more robust and transparent and effective enforcement, knowing who's selling the product, where, when, the prices, etc. I think is important. It's hard to deal with a monster when you don't really know what it looks like, and I think that there's still a lot of way to go in terms of the tobacco licensing system, and surely even more in terms of vaping products. In terms of, I think, the licensing, one of the points that has been brought up is that it should pay for enforcement of retailing surveillance. And I think that in addition to that, it should also contribute to anti-contraband measures and the enforcement of that. That's a big package, and convenience store and vape shops would be the first to benefit from contraband or more robust contraband interventions. So that's something to keep in mind. And that's why I think it's so legitimate that Ottawa has that high fee, licensing fee, and that's, you know, what other jurisdictions should be aiming towards. But more broadly, and I don't want to be taking up all the time, but I just want to say that I think we're facing so many issues in terms of product regulations that I think that we have to think twice about just prioritizing access measures. The industry wants us to go there. In many ways, it's an easy response. And I think it diminishes the political appetite and viability for effective product regulation. And that's something that we need to keep in mind.
Thank you, Flory. So you're reiterating something that Emily mentioned, which she found in the literature, which is that there is some risk in prioritizing youth access restrictions if indeed they take our eyes off of the target of other perhaps more important, I don't know if I should say important, other measures that might do even more to reduce usage. Tough. It's a tough one, and you know you've talked about prioritizing licensing, enforcement, and fees for the licensing to pay for other things. Les, do you have a different perspective on these?
Well, thanks, Rob. I'd like to thank GoTrue for this great work and producing this excellent policy series. I think the number of people who are participating today is a good indication of the demand for this type of information, so it's much appreciated. And Rob, I've got one word to answer your question, and that word is alignment. We need to simply align restrictions on vaping products with those on tobacco because they've been successful. And it's no accident. We've got the lowest smoking rates on record. And the Canadian Community Health Survey came out last week and revealed that we do have indeed the lowest smoking rates on record. And same with youth. We've made tremendous progress. It's because we've taken significant action on various policy measures, effective programs, tax increases. So we really need to align. Now I'm going to go to my script here for a minute and just tell you that effective restrictions on sales to minors can indeed reduce youth smoking, and they can be expected to reduce youth vaping. Retail licensing and robust enforcement are essential. Raising the minimum age to 21 will help to get vaping and smoking out of high schools. Reducing the social acceptability of youth vaping will help to reduce social sources. And high-profile convictions can also help reduce acceptability. So we need to, if we're going to have these laws, we need to enforce them. The public should be encouraged to report violations through web links and phone numbers on signage. We know that overall compliance with the federal vaping legislation among retailers, among vape shops, is abysmal across Canada. And it's a strong indicator of sales to minors. I really don't have much faith in government compliance rates on sales to minors because government enforcement numbers don't reflect real world circumstances like kids lying about their age or their identity. Government test shoppers are told not to lie and they're told to produce their actual identification. So how do you get a read on actual compliance rates? Of course, with masking, it's impossible to identify the age or identity of a minor. And retailers might be very reluctant to ask someone to remove their mask. Again, we're just recommending that governments align restrictions. And if we need more research around this area, it's on the entire marketing mix on vaping products.
So let me come back to you, Les. I asked for one or two things. You gave me a whole basket. Maybe that's the political person in you. So if you need to choose one, what would that one be? But let me ask you another question also. So you talk about aligning e-cigarette youth access restrictions with those of combustible cigarettes. But in a way, it seems that one of the main suggestions here that Emily talked about is about actually restricting the sale of e-cigarettes to adult-only stores, which goes above and beyond what we have for tobacco anywhere in Canada, as far as I know. So what would that alignment look like? Are we going to restrict the sale of conventional cigarettes to adult-only stores?
Well, I think it's part of an endgame strategy, absolutely. And we sell cannabis from cannabis-only stores. We sell liquor from liquor-only stores. So, I don't think we should get ahead on vaping and leave tobacco behind. I mean, tobacco kills 50,000 Canadians annually. 1 million Canadians are suffering from health conditions as a result of tobacco use. We need to keep the focus on tobacco. We can't get too distracted here, but we can certainly use this as an opportunity to enhance the overall restrictions that we have and the full marketing mix on tobacco and vaping products.
Okay, and what's your one preferred if pushed by me?
It's alignment, Rob, simply alignment.
Okay. I want to give Flory and then Sean and Emily also a chance to weigh in, to retort, to rebut anything that's been said. And then I see Sean also has some responses in the chat. Go ahead, Flory.
I think one of the anomalies to deal with that can be done, quickly, and that has broader ramifications is the ban of online sales. Because we're not just talking about the sales per se. So in the reports, when you say that Quebec has banned online sales, part of it is that it also forces sales to be face-to-face. And so the delivery of the product is actually prohibited. And that's a huge a sticking point for the industry. So the industry, and I mean, whether it's convenience stores or grocery stores, have argued that they should be able to deliver cartons just as people are ordering all their groceries, add in a carton and stuff. They can do it for beer. Why can't they do it for tobacco? But I think I'm astonished at the amount of promotion that we see through online sales. And in my mind, that's a direct violation of the federal regulations. I mean, if the kids just need to say that they're 19, this is even before they purchase the products. This is the industry. The industry has an ability to promote its products. It's done all kinds of things on the internet in trying to seduce them with, the packaging, the collections, the skins, everything that can be done, and the flavors. So I think that online sales is like, it's a quick and fast one, and that should be dealt with. There's something very abnormal about allowing for the sales of tobacco and vaping products online.
I'll just say to that one, Flory, stay tuned, because we're working on another report precisely on that issue. Stay tuned about a year from now on that one. Sorry, I interrupted you.
No, I think that's, and you know, I think that part of the reason that I think that these are all complementary measures, but again, I think we have we have so much to achieve in terms of product regulation, whether it's the packaging, even the flavors, you know, many of the legislations apart from Nova Scotia and PEI and New Brunswick now have considerable loopholes with respect to flavors and things like that. And we see that the industry is trying to promote vaping products very much as a lifestyle product. I mean, the Vibe store that was in Ontario, and I could see more of them opening across the country, except we're prohibited by different measures. They're complete lifestyle stores. And so my fear would be that I think we'd be gaining a lot by getting rid of vaping products or even tobacco products in convenience stores. But then again, if we don't deal with the whole lifestyle that some of these shops are putting forward, I think we're stabbing ourselves in the foot.
Thank you, Flory. Emily, can I turn to you? And if you have any comments or thoughts about anything that's been said until now?
Yeah, just a really quick thought. And the phrase that's really sticking in my head is Les's comment about the importance of not getting distracted. And also, I'm thinking about the importance of keeping really clear public health goals at the center. And in the reviews that we did, I mean, I think the main finding is how interconnected all of these measures are and how they could be used for good or not for good. So you could put a minimum age 21 law in place and forget about pricing and forget about taxation and forget about flavors, and it really would harm the overall system. And just it's so important to just remember that, you know, things like minimum age is going to be affected by enforcement. You're not going to be able to address social sources without adequate enforcement. A retail licensing system could help prop up an enforcement system. So I think it's just really important to think about all of this from sort of a systems perspective and just applying logic when you're thinking about each of these things to make sure you're thinking about loopholes and thinking about unintended effects.
So I got two words: alignment and logic. Okay, Sean, and Sean, maybe you can also just address a couple of the comments in the chat about driving, you know, if we do too much on youth access, we're going to drive up the illegal market. And also there's a bit of, can I say chatter? That's not meant to be demeaning. There's some comments in the chat about the questions of penalizing youth who make or try to make these purchases. Sean? Yeah, we can't hear you, Sean.
Sorry, I had myself on mute. Yeah, some jurisdictions around the world, and I think there might be one province and maybe even a territory that have possession laws for tobacco, if not vaping. I'm not sure if it was Alberta less or not, but in any regard, a large number of people in the tobacco community are against possession laws. That is, having penalties to youth that are in possession of products, fining youth or whatever else if they're in possession of products. Many in the tobacco world are against that, and I think for good reason. And the rationale is that, and the industry, the tobacco industry most notably, has pushed jurisdictions, or trying to push jurisdictions to go and have possession laws, which I think is which should be a flag for people. And the reason that it's not a good idea, I would argue, is that it takes scarce public health resources or even enforcement resources and directs it towards youth and away from retailers. I think you want to go for the source. You want to, there is laws out there about selling products for good reason. I think if you had possession laws, you're building, you're splitting your resources, and you're also giving ammunition to the tobacco industry to say, hey, go out and get those youth, run this program, run that program, do this enforcement of youth. All that takes the pressure off retailers and the industry. And, that's a simplified version of a very complex problem. But I am sold by that argument that, in theory, and if you had all kinds of money and there was, time and there was no issue, maybe possession laws would be fine. But I think in this context, with limited resources, possession laws, I would argue, and many would join me, are not something that we want to pursue. So with that, I can follow up on the question about regulation contributing to an underground market. I don't think that would be the case. I think it would be the case if tomorrow you prohibited the sale of cigarettes in Canada, and I don't think many advocates would suggest that you want to totally prohibit the sale of e-cigarettes or cigarettes overnight. That would lead to a contraband market. I think if you phase in, you have an endgame strategy, and you phase in different policies and programs over a period of time, I think it's doable without increasing or substantially increasing the illicit activity around that. And I would just point out that if you look at liquor, the density of liquor stores in jurisdictions relative to tobacco stores or e-cigarette stores is a big, there's a huge difference. A lot of communities will have, 1 or 2 liquor stores, and they'll have, 100, 200 retailers that sell e-cigarettes and tobacco products. You can do a whole bunch at retail for tobacco and e-cigarettes and not even come close to the restrictions that many jurisdictions have for alcohol and many jurisdictions have for cannabis. And we know that although there is contraband activity with those other products, there's not a whole bunch, and it hasn't really increased like that. So I don't think by having more and more restrictions on e-cigarettes and tobacco, that it's going to lead to any contraband, any large upsurge of contraband that can't be managed hand in hand with new regulations and new programs.
Thank you, Sean, and thank you to our panelists. I'm going to I'm seeing in the chat a lot of conversation about the youth possession. There's differences of opinion. I think we can just leave that there for now. What I'd like to do now is ask a second question of our panelists. And we'll start with Les this time. What is some additional research that would support your advocacy work regarding youth access to cigarettes? Do you have everything you need, or what would really help drive home the points that you're trying to make?
Well, this research helps, Rob, and it's greatly appreciated. It's cutting edge, and we need to know what the evidence is telling us, and we can relay that to our governments and policymakers. I think we need more about the full marketing mix, and that applies to tobacco as well. And we have a lot of research with respect to the place, where we sell, how we sell, and the price. We know that price increases can reduce consumption, but not as much on the product itself. So I think we need to go there. But I would actually like to see more research on the huge contradiction between nicotine vaping as a harm reduction strategy and the explosive rise in recreational vaping and youth vaping. Any benefit that could have been derived from the harm reduction approach in Canada has been completely wiped out by the massive increase in youth and recreational vaping. As you know, Rob, one study shows that there are 80 youth vapors that take up smoking for every smoker who quits using vaping. That's one study, but it's telling. And the harm reduction approach is failing because of the unintended consequences with youth and with the recreational market. So we need more research to show how badly it's failing, and to encourage governments to focus on effective measures to reduce youth vaping and youth smoking.
Thank you, Les. Florrie?
So for me, it would be different models with respect to retail density. I think like we're hearing of things that have happened in Philadelphia and that are happening in California, but I think it's hard for us to understand how it's really playing out. You can see how is it playing out in the neighborhoods, how is it playing out in low SES neighborhoods. And I think that as we're all looking forward to like a real endgame strategy, for a long time we've concentrated our discussions on what shouldn't be done at point of sale or in terms of retailing. Now we have to, I think, realistically start looking at how things should be done, or ultimately if tobacco, if there's a few places that are remaining in terms of tobacco sales, or even for vape shops or vaping products, what do they look like? Where are they? I'd like to see a contrast with, medicine, the availability of medicines and pharmacies, and how that plays out in comparison to tobacco and vaping products. So I think for me that the interest is really in terms of retail density. Quebec reduced the number of retailers in 2005 by half. It went from being 20,000 retail places of retail, including vending machines and mobile points of sale, to these brick and mortar places. But I don't think we've seen a huge impact of that. But I mean, on paper, and I've seen some of the research from the States, retail density, and even in Finland and Hungary, it seems really interesting. And so I'd like to know a little bit more about that and how it's playing out.
Thank you. And as you're talking, I'm just sort of pinching myself because we have so many natural experiments going on right now, just in Canada, in terms of different models of retailing e-cigarettes. That we haven't done those studies, right? So the data from the population studies in terms of consumption and prevalence are not sufficient to really understand what's happening with those models. I would love to do that study. If there are any funders online, please give me a call. But yeah, it's something we should try to get funded and make happen. Thank you for that. Yeah. There's a bunch of chat about Les's comment of the harm reduction versus the big uptake by youth, and there is some studies are being posted there. We are running low on time. Sonia, I hope you're listening. Are we able to unmute any questioners if anybody from the audience wants to actually pose a question orally?
Rob, I think Sonia might be having technical difficulties.
Oh, okay. Do you know the answer, Emily?
I don't know how to do that, sorry.
Okay. Oh, I think I can. So yeah, it says we can ask to unmute. So I'm just going to ask, is there anybody who would like to pose an oral question at this point? If you do, then you can raise your hand electronically, and I will see it. Once, twice, 3 times. Okay. I'd like to give each of the panelists a chance to for last words, and if you want also to talk about what would be your highest priority, what would be a way for you to increase the priority of youth access in terms of all of the things that are on the agenda right now regarding e-cigarette policymaking, if you think it should be done. And I remember your remarks earlier, Flory. You want to start off, Flory?
So I think one factor that that has played against us is how the industry uses retailers and pits them one against the other, lowering prices, being more amenable to promotion and different things like that, and often even kind of urging them to be uncompliant until they get a first warning and things like that. So I mean, I think that things that regulate prices that serve to uniform prices across regions or territory are key. And I think as we move forward with retailing, or retailing reform, I'm not saying that we need to keep in mind what retailers or what the industry says or what it's advocating for, but I think we certainly need to understand how the industry controls a lot of what's happening at retailing, and how and that's I think a primary step in us moving forward in dealing with effective retailing measures.
Thank you. Les?
Well, youth access is part of a comprehensive strategy to reduce tobacco use, and it shouldn't be overlooked, but it also shouldn't be overemphasized. Again, we have to look at the full marketing mix here. There is no magic bullet to reduce youth smoking or youth vaping. We need a comprehensive strategy. And a number of provinces of municipalities, for instance, license retailers, and we need to license vape shops. We need uniform restrictions on all forms of public smoking and vaping. We could use effective mass media campaigns to help denormalize smoking and vaping across Canada. There are enormous mass media campaigns in the US, and they're having an impact. And we should be doing the same here. We can't overlook taxes. That is so important. It's crucial in pricing strategies. Taxes are the single most effective means of reducing smoking, especially among youth. I think, we all know that COVID-19 has taken up a lot of oxygen for the past 18 months. Youth vaping was quite high on the public agenda prior to COVID-19. We need to get it back there and continue to press governments to clean up this mess.
Thank you, Les. I'll just ask Sean and Emily if you've got anything pressing you wanted to say.
Sure. It's kind of beyond the scope of this project, these reports, but as mentioned already a couple of times, price and the price elasticity of demand of youth smoking is key. If you increase the price, you're going to get fewer youth smokers being able to purchase cigarettes. So I think price is big. I think outlet density, reducing outlet density is big. And so if you're, someone said in the comments, like, shut them out of retail and only have them into specialty vape shops, that's basically reducing outlet density in a form. I think that is important. And age 21, it's an easy thing to do. And I think, it makes it that much more difficult for, high school students to take up these habits and to share in the social sources, which is so big, the social sources. I think if you change it to 21, you're kind of limiting a lot of that social sources around. And it's, like I say, it's an easy thing. It's a piece of paper, sign it and get it passed, like PEI did, like the US did. And it could have some outcome, but price and outlet density probably as important, if not more important.
Thank you, Sean. And Emily?
I've just been thinking in closing, while everything is so interconnected, I see sort of enforcement and compliance to be sort of at the center of my concern right now. And in looking at what's happening in the provinces and territories, it was really difficult to tell to what extent the enforcement systems align with the best practices. And then the other thing to mention is that the best practices that we were reviewing in the slides today actually come from conventional tobacco, but there might be some need to think about innovations in how there could be some different incentives or and penalties specifically for e-cigarettes. So I'd really like to see some more work and emphasis there.
Okay, it's to me to wrap up and to thank our panelists, Flory and Les. Thank you so much for your insightful remarks and for joining us once again. Thank you to Emily and to Sean for what I will say is great work and for bringing this to our attention. Thanks, a special thanks to the participants in the live and very active chat. I know we haven't addressed everything that's there, and there have been several comments about additional things beyond youth access that should be looked at. We will save the chat, and we will try and get back to individuals with some additional responses as we can. I just want to mention that we are coming up towards 5 years to the National Tobacco Endgame Summit. So please stay tuned. We will be making an announcement about some activity on the anniversary of the summit, which I believe is September the 30th. And we will be planning for a webinar sometime in November to mark that event and to rekindle energy and efforts to move us towards that less than 5 by 2035. Thank you all. Bye-bye.